So video 7, we will continue with revised National Tuberculosis Control Program, which is RNTCP. So introduction, so we know that tuberculosis is an infectious disease which is caused by Bacillus microbacterium tuberculosis. It typically affects the lungs, which is called as pulmonary tuberculosis, but can affect other sites as well, which is called as extrapulmonary tuberculosis. Okay, so it can affect the bones, it can affect the spine. Okay, so the disease is spread in the air when people who are sick with pulmonary TB expel bacteria. So it is droplet infection, and it is said that infected person, with TB, when they cough, they are prone to spread the infection to 15 to 20 people. And then if the people around them have low immune system, they will contract tuberculosis. For example, by coughing. In general, a relatively small proportion of people infected with Mycobacterium tuberculosis will develop TB disease. So TB is also more common among men than women. It is said that incidence is more among men and affects mostly adults in the economically productive age groups. Okay, so it is so it is mainly seen in the economically productive age groups, that is young age. Okay, so burden of disease, please you can go through the numbers and the incidence, all the rate has been given, and evolution of TB control in India, also the various program that is given here according to the year you can go through. So we will move to next page, that is 4. So talking about the phases of RNTCP, tuberculosis control activities are implemented in the country for more than 50 years. Now it has become more than 50 years. We have already started the control program. The National TB program was launched by Government of India in 1962 in the form of District TB Center model involved with BCG vaccination and TB treatment. So in 1962 it was started. So they were giving BCG vaccination as well as TB treatment was done. Okay, so phases you can see there are totally 4 phases, and you have different year which was implemented. Phase 1 during 1997 to 2006, phase 2 from 2006 to 2011, phase 3 2012 to 2017, phase 4 2017 to 2025. Okay, so now talking about phase 1, so in 1978 BCG vaccination was shifted under the expanded program on immunization. So now this BCG vaccination came under a program that is extended program on immunization. A joint review of NTP, that is National TB program, was done by Government of India, WHO and the Swedish International Developmental Agency SIDA in 1992, and some shortcomings were found in the program such as managerial weakness, inadequate funding, over-reliance on X-ray, non-standard treatment regimens, low rates of treatment completion, lack of systematic information on treatment outcomes. So through this program, all this organization, they found out there were certain amount or certain shortcomings through which the program was not becoming very effective among people, where like they were not managing properly. Okay, managing skills, okay, were very poor, inadequate funding, they didn't have adequate funding, and they dependent on X-ray and non-standard treatment regimens, low rates of treatment completion, so and lack of systemic information and treatment outcome. So this did not prove very effective. So around the same time in 1993, WHO declared TB as a global emergency, devised the directly observed treatment, short courses DOT. So here is when they started the treatment DOTS. What is DOTS? Direct observation treatment therapy, okay, that is given. So what will they do in DOTS? The nurse will make sure she will go from the PHC, or she will ask the person to come to the PHC in front of the healthcare workers. They have to take the medicine, or they can also assign the work to their family member who will supervise whether the patient is taking the medication or not. Why this DOTS came into existence? Because patients were not taking the medications properly, because this tuberculin drugs would lead to lot of adverse effects, and getting scared because of the adverse effects, what was the patient doing? The side effects. Okay, the patient started ignoring the drugs, and thereby it will lead to complication. They would also spread to others, and there was deaths that was happening. So for that, this DOTS was introduced and recommended to follow it by all countries. The government of India revitalized NTP, that is the National TB program, a revised National TB control program. Okay, so now NTP became revised National TCP, tuberculosis control program, okay, in the same year. So bringing in the DOTS therapy. DOTS was officially launched as the RNTCP strategy in 1997, and by the end of 2005 the entire country was covered under the program. So this lead to lot of improvement. So this is about the phase 1. Okay, so we see what all have happened. So 1978 BCG vaccination came under expanded program of immunization, which was made mandatory to be given to all the patient, all the individual. Then NTP was done by government, but they found out that there were lot of deficiencies. So we have already seen what are those. And then they brought into existence, right, in the 93 somewhere, the DOTS therapy. So this became a revised National TB control program. Okay, and it became a strategy in 1997, and the end of 2005 the whole country was covered by DOTS. Now phase 2, we will see what exactly happened during phase 2. So this RNTCP improved the quality and reach of services and worked to reach global case reduction and cure targets. So this program was much effective. These targets were achieved by 2007 to 2008. So despite these achievements, undiagnosed and mistreated cases continue to drive the TB epidemic. What happened? Even though it was very effective, still there were cases which were not detected and through which there was outbreak of diseases to other people, which was epidemic. TB was the leading cause of illness and death among persons living with HIV and AIDS. So we know that because of the immunosuppressed patients, that is mainly in HIV or AIDS patient, what was happening was, so these patients were prone to develop this TB and a large number of multi-drug resistant. So many patients started to become resistant to the drug because this tuberculosis drug was not functioning in them. Cases were reported early here. So though RNTCP was good during phase 2, which was from the year 2006 to 2011, what happened was, people were still undiagnosed and it was leading to epidemic, and they also found that HIV patients were getting infected with TB, and then they also found that many were multi-drug resistant. This TB drugs was resistant in few of the individuals. So phase 3, so during this period for achievement for the long-term vision of TB-free India, National Strategic Plan for Tuberculosis Control 2012 to 2017 was documented with the goal of universal access to quality TB diagnosis and treatment for all TB patients in the community. So here they planned for TB-free India, and then they had plan for tuberculosis control from the year 2012 to 2017. And what was the goal? Universal access to quality TB diagnosis should be done and treatment to all the patients suffering with TB in the community. So significant interventions and initiatives were taken during National Strategic Plan, that is 2012 to 17. Because of the goal, they started really working hard. They started taking many initiatives and they started doing the interventions for that. And then in terms of mandatory notification of all TB cases, integration of the program of the General Health Services, National Health Mission, they worked with the National Health Mission, then expansion of diagnostic services, then programmatic management of drug resistant, service expansion, single window service for TB, HIV cases, national drug resistance surveillance. So they started concentrating on HIV patients, and then drug resistant surveillance, close observation of the drug resistance among the individuals were noted, and revision of partnership guidelines are also taken during this phase 3. Okay, now phase 4, to eliminate TB in India by 2025. So that's the goal along with COVID now. Okay, so COVID also has become, they are saying live with the COVID, right? So still vaccine is not being found and we don't know how long it is going to be there. Okay, so here to eliminate TB in India by 2025 was a goal set under phase 4. So 5 years ahead of the global target. It is a global target all over the world, and then a framework to guide the activities of all stakeholders who are interested, including the national and state government, development partners, civil society organization, international agencies, research institutions, private sector, and many others whose work is relevant to TB elimination in India, is formulated by RNTCP as National Strategic Plan for Tuberculosis Elimination 2017 to 25. So here, along with other agencies, as we have seen, they have planned to totally eliminate the tuberculosis, which will happen during phase 4, that is from the year 2017 to 2025. So these are the 4 phases. You should know the year and what all they have set up the plan, how it was revised, and what is the goal of each phase according to the program. Okay, next we will go to National Strategic Plan for Tuberculosis Elimination. In detail we will see, that is from 2017 to 2025, what they have set up. So this, the NSP, that is a National Strategic Plan 2017 to 25, it builds on the success and learnings of the last NSP and encapsulates the bold and innovative steps required to eliminate. So it requires both step, right? So this plan to eliminate TB in India by the year 2025, they totally want to eradicate the tuberculosis. The NSP 17 to 25 is a 3-year plan and an 8-year strategy document. So they have 8 strategy and then it is for 3-year plan. This NSP replaces previous strategies. Whatever strategies they had before, this is replacing that, and will inform and guide the updating of technical and operational guidelines and associated program tools. So it will also inform and guide the updation of the technical and operational guidelines that is used in the NSP. Now what is the vision of NSP? Nothing but TB-free India with 0 deaths, disease and poverty due to tuberculosis by the end of 2025. It's not given, but we can add. So the plan is ending up by 2025. And what is the goal? To achieve a rapid decline in burden of TB, that is decreases in the case, morbidity, mortality, while working towards elimination of TB in India by 2025. Then what are the main objectives? To find all drug sensitive, who are sensitive to the drug or whoever are drug resistance, with an emphasis on reaching TB patients seeking care from private providers and undiagnosed TB in high-risk population. So they have to find out all the undiagnosed people and then drug sensitive, drug resistance people, so treat them accordingly. To initiate and sustain all patients on appropriate anti-TB treatment wherever they seek care with patient-friendly system and social support. So to initiate and sustain all the patients, so they should be sustained through the anti-TB treatment. Okay, so whenever they want any care or patient-friendly system, social support to be given to them, they should not be ignored. Okay, to prevent the emergence of TB in susceptible population, wherever are high risk, there they have to do the surveillance and they have to prevent the emergency by treating them accordingly. The last one, to build and strengthen enabling policies, empowered institutions, additional human resources with enhanced capacity, and provide adequate financial resources. So to achieve that, you required manpower, you required finances, you required adequate resources. So you have to enhance all this. So meeting and building and strengthening all these areas. So these are the 4 objectives of the NSP plan, okay, which is the National Strategic Plan for Tuberculosis Elimination 2017 to 2025. See, all recent year program you should study, okay. It is important on the basis of your board exams as well as university exam, because we are still implementing that, we are in that phase. So you have to study the current programs, okay. Then you can see a diagram here that is given the framework, please go through that. Okay, so what are the reduced estimated TB incidence, prevalence, mortality, catastrophic cost, that is, for affected families. So all this you can please go through. Next we will go to strategic pillars. The requirement for moving towards TB elimination has been integrated into 4 strategic pillars of detect, treatment, prevent, build. So these the diagram you can see. First you have to detect the cases, you have to treat, then further you have to prevent, and you should help in building up of the health. Okay, so these are the 4 things which we will be seeing in detail. I think I will continue in the next video. Okay.